This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome to Decoding Dentine Discussions, the podcast where we explore the latest insights and best practices in the world of dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and today we've got an enlightening episode for you, Preventing Dentine Hypersensitivity, Tips and Tactics. So today, joining me, we have Dr. Ninette Banday, who's played a key role in teaching and running dental services, as well as setting up dental internships, residencies, and training programs, first at Aga Khan University and Hospital, and later in the public health sector in Abu Dhabi, UAE. And Dr. Tim Theuri is also joining us. He's a principal dentist at Dental Access Clinics in Nairobi. He's also the president of the Kenyan Dental Association and CEO of the Kenyan Healthcare Federation. Welcomed you to the show, and if you can just give a brief intro about yourself.
Thank you, Dr. Shaista, for the introduction. This is Dr. Ninette Banday from Abu Dhabi. Right now, it's a pleasure to be at this podcast, and I'm going to be with you all for this session.
Dr. Tim, introduce yourself as well again, please.
All right. Thank you, Dr. Shaista. My name is Dr. Tim Theuri. Happy to be here, taking this from Nairobi in Kenya. And I sit as the president of the Kenya Dental Association. It's the largest association in the region. That's the largest East African region. Elsewhere, I do run a practice, and I am the principal dentist at the Dental Access Clinics in Nairobi. And I do also serve as the CEO of the Kenya Healthcare Federation, where we take care of the private sector in the country. So that's who I am and what I do. I'm also a dad and a husband.
Together, we'll be discussing the prevalence of dentine hypersensitivity across the different regions, its socioeconomic impact, and the importance of prevention and the cost effectiveness of various prevention strategies. So, as a recap, I just wanted to say in previous episodes, we briefly discussed the prevalence, but I'd like to hone into our specific areas, which is the Middle East and Africa. And so both Dr. Ninette and Dr. Tim are going to be shedding light on this. This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne does more than reduce the pain of dentine hypersensitivity. Sensodyne with Novamin can help repair and protect your patient's exposed dentine. So before I start asking you questions, I just want to give a bit of a preamble. In June 2024, Halion and CAP hosted an international advisory board focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we're exploring the key outcomes and clinical insights from that event, offering practical advice and evidence-based approaches to improve patient care. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. So one of the first key questions that I'll be asking them both is, what is the dentine hypersensitivity prevalence in their specific areas, so across the Middle East, Africa, and Pakistan? So I'll start with Dr. Ninette, first of all, please, if you could shed light on this.
Thank you, Dr. Shaista, for the introduction. As you asked the question, the prevalence of dentine hypersensitivity is increasing globally, including the Middle East and the African regions. Studies conducted in the Middle East region demonstrates a relatively high prevalence of dentine hypersensitivity than the studies in Europe and Asia. Although factors such as drinking, soft drinks, acidic drinks, age and sex are common correlates for the dentine hypersensitivity across most of the studies that have been done, the higher dentine hypersensitivity prevalence in the Middle East region calls for a lot of interventions to reduce the burden of this big oral health condition, and also for proper management for the clinicians that have to have proper understanding of the condition and its treatment. So if you look at it, in the region of Saudi Arabia, the burden of this condition is about 35%. If you look at UAE, it's 30%. So there is a huge burden of this condition.
Dr. Tim, could you shed light on if you have statistics for Kenya or maybe Africa in general?
I think on our end for Africa, not much of studies have been done, but the little we have, of course, is in keeping with the countries that have done quite some work on oral health and dental work research. And this shows that in countries like Nigeria, we have about 16.3%, Tanzania about 46.4%, and 28% in a country like Egypt. I think the main thing here is in keeping with it's not the condition that comes up at the top of the clinician's mind, and I really hope that in conversations like this we will manage to ensure that it gets the attention that it deserves, and the undiagnosed cases come to the front.
Okay, so my next question is you guys have mentioned specific numbers and statistics. Are you able to correlate this with specific habits across the Middle East and Africa?
Yes, there are some similarities in the prevalence and causes of dentine hypersensitivity between the Middle East and Africa. These regions are not monolithic, and the differences in the prevalence are likely due to a combination of the cultural practices that prevail, the dietary habits, the socioeconomic factors, and access to healthcare. In both regions, you see, as we know, dentine hypersensitivity is often linked to poor oral hygiene, gum recession, and enamel erosion. But specific factors like the use of miswak, which is the bark of the tree that is used for practicing or doing brushing traditional diets, or stress-induced bruxism, which is grinding of the teeth, may vary across the regions, potentially influencing the local prevalence of the condition.
Okay. You mentioned the miswak, so I'm just a little bit curious here, because I guess its use of miswak is steeped in A, local tradition, and B, possibly religious reasons. So do you think this is something easy to address, to, if you want to say to patients about how they're using the miswak when they're using it? Is it an easy area to speak to them about?
You see, it's a cultural habit. And of course, from religious point of view, it's a very positive method to do oral hygiene. But yet you have to convince the patient that, you see, when you use it, because they take a bark of the tree and they use it constantly like a toothbrush. But you have to also tell them that when you are going to reuse it, you wash the bristles and then use it. And then also they have to keep it in a way, because you will find lots of people keep it in their pockets and travel, and every time they take it out and start brushing with the miswak.
That's very true. Thank you. Dr. Tim, have you found any correlation between prevalence and specific habits in the Africa region?
All right. I mean, because of the kind of data we have, anecdotally, I'd want to believe that among the causes of hypersensitivity are dietary habits, which will vary from region to region, because Africa is definitely not homogeneous in terms of its cultural extractions, and with this come various dietary habits. I think poor oral hygiene practices, as well as habits such as bruxism, have direct correlation with dentine hypersensitivity. Hard bristled brushing, the miswaks that have been mentioned, smoking, clenching, and excessive brushing definitely do play a role in the erosion and wear of enamel, leading to dentine hypersensitivity. Yeah.
Okay, perfect. Thank you. So we've spoken about causes as well, what results in dentine hypersensitivity. What I'd like to understand, and I appreciate that this, I think, will vary across the different regions, also it will potentially be based on socioeconomic factors and access and so on. So I'd be quite interested in hearing your answers. So we're going to be talking about the importance of screening, record taking, how all this is done. So first of all, Dr. Tim, could you explain to us why you think dentine hypersensitivity is important, the relevance of this?
I think from where we start, it largely remains undiagnosed, and there is nothing that, if remaining undiagnosed, would be, of course, leads to other complicating factors, and the eyes can't see what the mind doesn't know. So I think one of the most important things when it comes to screening.
Sorry, I'm just going to interrupt you there. I really like what you said there. The eyes can't see what the mind doesn't know.
Yes.
I think this is a really big and important statement, actually. Sorry, please continue.
Yeah. So the eyes can't see what the mind doesn't know, and I think it's incumbent upon us as associations, as dentists, key opinion leaders, and the industry, especially on the commercial side, to facilitate the percolation of knowledge. First of all, early detection is really important. It allows for early diagnosis, treatment of the condition. It prevents the pain and the discomfort that comes with this, and also preventing it from worsening. Pre-service training at undergraduate level will be very important. Also, it will be important to prevent further damage, so early intervention. So upon detecting this and diagnosing it, we need to have early intervention to prevent further damage to the teeth and things like tooth decay and gum recession. And more importantly, I think people do come to dentists or they seek oral care mainly to improve their quality of life. I mean, beyond the pain, the discomfort, and wanting a perfect smile, it really goes hand in hand with the quality of life. And this will significantly improve a person's quality of life by helping them now eat a wider range of foods: the hot, the cold, the sweet, the slightly acidic foods and drinks. And also in identifying underlying causes, we need this screening to help us identify them, and and things like recession, like I mentioned, tooth decay, can be addressed using appropriate treatment, and the earlier the better, and the more affordable for anyone. Yeah.
Absolutely. So I think, Dr. Ninette, what I would like to know from you, Dr. Tim, I feel, has spoken about prevention, maybe from a private practice aspect, or maybe private practice is the wrong word, but from a general dentitioner aspect. I'd like you to elaborate on how is screening done, because you've got a lot of experience at in teaching hospitals, helping set up internships and so on. So has this been something that's implemented? How is screening done in those environments?
See, we have to realize that there is a lot of difference of this condition as far as population is concerned, geographically, the age, as well as the socioeconomic status of the different groups across the different regions. So the geography, the age, and socioeconomic status all play a very significant role in determining the prevalence of and severity of dentine hypersensitivity. With regional dietary habits, access to care, and lifestyle factors contributing to these differences. As far as geography is concerned, there are many areas where there is very poor oral hygiene habits, the diet, acidic foods consumption, or limited access to dental care that plays a high role for higher rates of the prevalence of dentine hypersensitivity. Then there are climatic reasons, like in regions where there is where it is very dry, there is more consumption of water, as well as acidic drinks, like lemon, water, is something that a lot of areas where people would turn to. Then use of traditional oral hygiene habits like tools, as we mentioned, miswak, also contribute to the high prevalence of dental hypersensitivity. Age is another area that we have to be concerned about. And this is an area where we have to teach right from the beginning, the proper oral hygiene habits is in schools and then in the hospitals, and as we see patients both in the private clinics as well as in the government sector. Socioeconomic status plays a role because, see, areas where the low socioeconomic status, then they have poor access to healthcare and lack of education. That is important to keep in mind.
So, do you have any anecdotal stories that you've worked in Pakistan, you've worked in the United Arab Emirates? You would have seen that variance in the different socioeconomic groups. You would have seen that variation also in the knowledge available to them. Do you have any stories to tell us about that? So what have you sort of come across in Pakistan that's maybe different to the UAE?
You see, a lot of times the patients, when you see them in the I've been practicing in the UAE for the last 20 years, and you have a lot of patients who would come to us in the clinics, and they have a lot of recession, and you ask them that you are brushing too hard. So they would say, yes, I brush very hard. I use a hard brush to make sure my teeth are nice and clean, not realizing that they are causing a lot of recession with exposure of the roots, and then the cementum, and of course goes into the dentine, and then dentine being softer than the enamel starts to erode even faster. So then there is a big issue. In Pakistan, yes, the thing is that because of the poor economic status, you will see certain categories where they cannot even afford a toothbrush. So they are using the miswak, which is the bark of the tree, and it's not well maintained, with lots of bugs growing in the miswak bristles itself. So we have to treat them and teach them in a different way.
Yeah, absolutely. Thank you for that. Dr. Tim, I will come to you. So have you noticed any differences in populations geographically, age-wise, or in socioeconomic groups in where you're based?
I think from my experience, and I began taking note maybe the last 4-5 years, adults are a little more affected in the distribution, and economically challenged individuals report way less because of this notion that if I come in for care, it's going to be expensive. All sorts of things will need to be done on me, and I cannot afford it. And to be very honest, I sort of can live with this, though not comfortable, but I try and push to see where this gets. The people who can afford care at the slightest discomfort, of course, will come in and say, I'm experiencing this, and eventually when you probe further, you find this is dentine hypersensitivity. But my association with dietary habits, I think those are a modifier for this particular condition, because access to processed foods, frequency in eating, definitely, in my opinion, anecdotally plays a role in this. Not much of experience with children on my end. In the public sector side in the country, this is largely unreported for sure, because we'll tend to see more of the infective trauma and more serious dental conditions, and dentine hypersensitivity definitely does not rank quite highly for most of the people who will be seeking care in our public facilities in Kenya and more so in the continent.
Okay, thank you. So we can see that it is a problem. There's a lack of education in patients, in the general public. It's not placed quite high up there. They probably give importance to other things than feeling that sensitivity. And as you've both said, they learn to deal with it. They just become silent copers, basically. So what I'd like to discuss next is prevention strategies. So Dr. Ninette, starting with you, what do you think are important strategies? What methods would you implement?
When you talk about prevention, the first thing that comes is in your mind is oral hygiene, and you maintain that with proper brushing. So you have to teach the your patients or the population or the group you are addressing to brush gently with a soft bristled toothbrush and use a toothpaste which has fluoride. And you also have to show them that, when you use this, and if you have dentine hypersensitivity, you can apply it on the teeth, leave it for 3 to 4 minutes, and then brush. I know there are certain schools of thought, they say that apply and leave it for, just spit it out and don't rinse or swish for half an hour. So there are different schools of thought. Then you have to also tell them to avoid acidic foods and drinks if consumed, and rinse with water or drink through a straw. They should also limit sugary snacks to reduce tooth decay. Visit the dentist regularly for biannual cleaning, fluoride treatment, and desensitizing applications if you have dentine hypersensitivity. Sometimes you want them even to use a night guard if they give you a history of bruxism. And manage stress to prevent teeth grinding and improve oral health. When we talk about stress managing, it's very easy to tell the patient that don't take stress so seriously,
Yes,
but in
that's so
reality,
true.
it's not possible. And you have to give them some kind of an aid with like a silicone guard or some kind of prevention method that they can avoid the grinding. Then you have to convince them to stay hydrated and stimulate saliva production to neutralize the acids and protect the enamel. And in any case, we should always make sure that our patients, as well as the population, consumes good, clean water, at least 6 to 8 glasses a day. And we have to educate them on proper oral hygiene practices and regular dental checkups.
Absolutely. I mean, just briefly touching upon proper oral hygiene practices, I think this is an interesting one. I see a lot of people where, the children, they brush their teeth after they've had breakfast. And I don't know where they've got this from, because obviously in my head I'm thinking, I remember very clearly from undergraduate school, the Stefan curve, right? So if you've eaten something, your mouth plummets into acidic levels, and it gradually goes back to neutralization over a period of 1.5 to 2 hours. And I'm constantly explaining to people that, you don't want to be brushing straight after you've eaten. That's just going to cause more problems than help solve anything, So it's just these simple things, getting everyone to understand that, right? And instilling that from childhood. So coming now to you, Dr. Tim, what would you really consider important to help implement prevention of dentine hypersensitivity?
I think I agree with Ninette, and in the sense that the best way to prevent is to allow things not to go wrong in the first instance. And of course, brushing, good oral hygiene practices, brushing with a fluoridated toothpaste really goes a long way. I think at the level of practice, in both private and public sector practice, screen all patients so that we get data and we're able to know what kind of decisions as clinicians and policymakers we need to take. I think something that I really consider now important, having interacted with this a little more over the last 5 years, is pre-service training on dentine hypersensitivity for our students is really important. Continuous professional development courses on identifying etiology and best prevention practices, creating communities of practice among the clinicians is really important. I agree with all Ninette has said. That's why I have I'm saying that are a little different. And of course, we need guidelines on how to deal with dentine hypersensitivity, so that the response to it is not based on a gut feeling, but based on data that we have collected.
Yes.
Like I said, of course, good hygiene practices. Checkups are really important, and insisting on checkups. Diet counseling. So that we're able to avoid abrasive, acidic foods that would worsen or have a causative effect to dentine hypersensitivity. And where the condition has already set in, then we may want to begin looking at desensitizing toothpaste and the uses as per recommended by the manufacturers of this.
Mm.
Yeah.
So I think really super important things that you've all mentioned. And I think one of the key things that has come about from the ad board that was done by Halion and CAP in June, and also what you've touched upon is screening all patients. I think it's such a simple, cost-effective tool. Just a simple, each time someone comes in, just a simple question, do you suffer from any pain, any sensitivity from your teeth? And then based on that answer, asking them more questions to find out things. And also the other thing mentioned here that we've briefly touched upon is the training of dentists. I think sometimes we can be accused of just, patient comes in, what are they complaining of? We don't always look around or focus on everything that needs to be checked and noted. We need to be more aware of prevention strategies, really. So again, based on where you guys are, I think this is going to be quite interesting. Do you think there's an issue with access for information for patients? So I'll start with you, Dr. Ninette. Again, I'd like to draw on your experience in both the UAE and Pakistan.
You asked access to information for patients. I would like to say before I start that you don't know what you don't know.
Yes.
So you see what happens, and this goes for both the patients as well as the doctors.
Agreed.
So
yes.
access to accurate, clear information about dentine hypersensitivity is crucial for both prevention as well as effective management. So that dentists should have the clear guideline, as Dr. Tim mentioned. So challenges such as lack of awareness, both is inconsistent in dental education, cultural barriers, and limited access to care that hinders proper treatment for the patients. So therefore, it is very important to understand so that we know how to address the issue of dentine hypersensitivity. So to improve patient outcomes, it is essential to increase public awareness, public education, and access to care. Ensuring that everyone, regardless of the location, regardless of their socioeconomic status, should receive the proper information and proper treatment guidelines if we really want to address the issue of dentine hypersensitivity effectively.
Yeah, agreed. Dr. Tim, would you like to add to this as well, please?
I definitely agree that there's a lot of typically low awareness on oral health, on general oral health conditions in Africa, mainly because the population is struggling with many other things, survival being one of them, and schooling the children and whatnot. So I think if is there an issue? Definitely yes. Can we do better? The answer is also yes. We do have few studies that have been done around this topic. So even professionals may not have the adequate information to disseminate to the people they see. That includes the teachers who are teaching the students, as well as the clinicians, dentists in the clinics. We do have, like in Kenya, a case where we do have community oral health officers. We do have community health promoters, and they've not been sensitized on things like dentine hypersensitivity. As an association, that's the Kenya Dental Association, we've gone a step further by training quite a significant number of the 100,000 community health promoters we do have in the country based on the WHO tool. And we really hope we will see information coming in. The other thing is the health seeking behavior. Patients tend to think, or rather the people who seek care tend to think that I should go to a dentist for serious conditions only, as opposed to having routine care and checkups. Interesting is that most of them will know the things they have in the house need to be cleaned, need to be taken care of so that they last for longer, but they don't think of this about their teeth.
Agree.
The other thing is, of course, studies and guidelines, so that the suspicion index of our caregivers goes up for dentine hypersensitivity.
Okay. So this brings me to my next question. I'll start with Dr. Tim. again, I feel that, say, in Kenya, broadly speaking, in Africa, it would be hard to reach certain populations. But along with that, I'm sure people have their own cultural beliefs, their own traditions of how they do things, what they want to do. Do you find that patients from your area are maybe resistant to adopting advice? Are there any barriers to adopting advice?
I think the relationship our patients have with doctors is one of trust, and the war against dental
Do they trust their dentist when they
Yes,
come?
yes,
I
yes,
mean,
yes,
I'm
yes.
curious that
Yeah, yeah.
they.
It's a relationship of
Yeah.
trust. I think the moment
Okay.
the moment you are sat on a dental seat,
Mm-hmm.
it's a moment of vulnerability. So there has to be trust, definitely.
Mm-hmm.
And
Absolutely.
yeah, yeah. And what I've noticed is they will listen. A good portion
Mm-hmm.
of them will implement our conversations, and
Mm-hmm.
we do have also a good number who will not pay attention to it. Some of them
Okay.
get better and discontinue
Okay.
with what we've agreed. So compliance is also something that needs to be really sensitized. The
Mm-hmm.
conversation on dental hypersensitivity will not be won in a day or a year. It will
Mm-hmm.
take some time. And as
True.
practitioners,
True.
industry partners, we must be in this for the long haul. So that at the end of
Yes.
it, we are able to trace back and say, this has been the roadmap to
Mm.
better screening. This has been the roadmap to more cases being picked up. This has been the roadmap to uh, more patients getting intervention. Um,
Mm-hmm.
I
Mm-hmm.
think among the barriers that come top of my head is cost barriers,
Mm-hmm.
where we operate in a price sensitive market that is within the African continent.
Mm-hmm.
So we must have interventions that are able to speak to a majority of the population. Increasingly, by 2030, 65% of our population will be youth. That's generally 35
Mm-hmm.
years and below. And
Yeah. Yeah.
these are people who are just out of school, beginning to work, may not have the economic power to access the premium products around dental
Mm-hmm.
hypersensitivity. So, how do we
Mm-hmm.
bridge this gap is something that we must seek to answer as both clinicians and industry partners. The other
Mm-hmm.
thing is, like I said, compliance. How do we improve oral health awareness? How do we get the
Mm-hmm.
message to the community? For any intervention on a mass or a wide scale, it
Mm-hmm.
must begin and end at the community level for us to be
True.
successful.
True. I
Thank you.
have one other question for you. You both have actually have been a big part of this ad board, this drive for dentine hypersensitivity, formulating a guideline, creating awareness. Over the last few months, especially after the ad board, has anything changed in your practice and how you discuss dentine hypersensitivity with patients or even with peers? Because you're CEO of an organization, you're part of the Kenyan Dental
Mm.
Association. So has anything changed?
So I think three things. The first one being that from where I sit at the Kenya Healthcare Federation, um,
Mm-hmm.
that's a body that organizes the entire private sector in health. We've begun
Mm-hmm.
to bring in conversation on exemption. Especially of customs duty, excess duty, and taxes generally
Mm-hmm.
for dental hypersensitivity products. We do hope we
Okay.
will have at least one of them uh, listed so that we be able to give care to
Mm-hmm.
majority of our people. The second thing is we had a conversation in the clinic. We have about 10 practitioners, and we were trying to think, how do we improve our suspicion index? How do we diagnose this a little more, if that's the case? And one of our
Mm-hmm.
assistants was like, told us, Doc, if you think that's the case, how about we give everyone a desensitizing toothpaste and then collect
Mm-hmm.
information after about 2 weeks on if they've noticed an
Mm-hmm.
improved quality of life from the conversation we had. And we thought that was very interesting, and we did that. So
Yeah.
all our patients who are coming in are getting a desensitizing tube.
Mm-hmm.
And interesting is we've had about 15 come back and said, I didn't know it was that bad for me. and now I'm able to
wow.
I'm able to tolerate cold water when brushing in the morning. I'm able to have ice cream for longer. So that's sort of the approach.
Did you tell
Very
them that's not the point? We want to cut down the sweet foods. We want to cut down the
yes,
acidity. It
of course.
doesn't mean you start eating all these
A lot of
things.
diet counseling is going into it, but I think it's a good indicator of
Absolutely.
out of maybe 300 350 people we've seen in between then as new patients, maybe 20 have come back to say there's a change.
Oh, perfect.
Yeah, so
That's
I think there's something there, and we are following it up.
amazing. So now I'm going to come to Dr. Ninette. So have you found any barriers in the, say, UAE or in Pakistan when you've been seeing patients?
You see, I know there are some barriers as far as managing dentine hypersensitivity is concerned, like cultural factors, traditional practices, and lack of awareness, as well as their health literacy challenges that are existing. But overcoming these resistance, and as mentioned, that the trust is extremely important. You see, because sometimes you have to show the patient says, I cannot drink cold water, or I cannot have ice creams anymore. So you have to show them while they're on your chair, take a mirror, show them that sometimes it's just the initial stages.
So just coming to trust issue, do you find, say, people in the UAE are more trusting of a dentist? Do you have a better relationship? How does that compare to, say, Pakistan? What is the dentist-patient relationship like? Is there even a variance amongst, say, socioeconomic groups as well?
You know, in the UAE, it's very interesting that the patients are now being convinced or being pushed to come and see the dentist biannually. The insurance companies are supporting that. So the patients are making a move and an effort to do. In Pakistan, you see, usually we used to see patients who come only when they are in pain. And the pain comes when the decay or the issue is really gone to beyond salvaging the tooth most of the time, and you would land up doing an extraction. So here, because the patients are a little more convinced that they should come to the dentist, it's a little more easier to help them. And once you show them that there is a recession, it's very mild. If you use a toothpaste with an anti-sensitizer, like high fluoride content, or so they feel the difference, like Dr. Tim says, they really come back, you know, because otherwise sometimes when they come and there is a lot of erosion, and you want to treat them by bonding, a lot of times bonding does not work because dentine is not so easy to bond the dentine compared to that. So you just aggravate the whole situation.
So have you, again, you've been a big part of this ad board and, helping with the guidelines. So my question also to you is, has that changed how you practice? And I'm curious to know, because you're in a teaching aspect of dentistry as well, has it had an impact on what you're teaching your students?
Yes, now you see we have interns who I'm working with, and yes, definitely you are trying to change their mindset, and we have to start somewhere. And definitely we are making efforts that, when patients are coming in, they are screened first of all, right from the beginning, not that they come with some signs and symptoms. So before even they reach to that, we are trying to make an effort that everybody who is being seen are well screened just by a simple question that does cold water or ice creams bother you, and then you take it from there. So of course it's a change in the mindset.
Perfect, thank you. So I wondered, do you guys have any stories, any cases that you could discuss with us about dentine hypersensitivity? I'll start with you, Dr. Ninette.
Yes, because sometimes you have cases where the patients come with severe recession, and this can be from trauma or from inflammation, and also because of the anatomy of the tooth itself. And this often becomes an aesthetic concern, and that's when the patient comes to you. When it's an aesthetic concern. If it's in the posterior teeth, they will try to manage or not to have cold water going to that part of their mouth. And it's only when it leads to some kind of a mucogingival defect, when they have lost a lot of their attached keratinized tissue. And once they reach that condition, of course, they want it to be addressed, and you will have to do some kind of a graft, an autogenous graft, which is the golden standard. So you take connective tissue graft from the palate. Again, it's a lot of painful procedures that comes to that. So all this can be avoided if proper education right from the beginning is taken into consideration.
Agreed. Dr. Tim, would you like to add any cases that you've had that stick out to you?
Yeah, I mean, I think for me, the most recent one is a lady who was she'd come in for routine dental work. Her wedding was about 3 weeks out. And she said after our first visit, cleaning was done. Second visit comes in and says that I've noticed that I've been having a sensitivity that I can't place a finger on. And what we found out was that her upper right region had some uneven wear. And of course, this was picked from her brushing technique. And for this particular case, I did recommend that she uses Sensodyne. And we by the time it was her wedding, we did have good outcomes for her. So I hope she went on for her honeymoon well. So that is one of the most recent cases that we've recorded at the practice.
So I think both the cases that you've discussed, I think what's highlighted to me is that discussion of prevention is such a big aspect of dentine hypersensitivity, and not only just discussing prevention, but having people understand what is the long-term sequelae of dentine hypersensitivity, what can end up happening, how quality of life is affected, the kind of pain this can result in. And, if you leave it, ignore it, you end up with more invasive treatment ultimately. And I think that should be used as a prevention tool as well, people to understand that we don't want it to get to invasive techniques, really.
Yeah.
Anyway, what I would like to do is I would like to thank both Dr. Ninette and Dr. Tim for joining us. This has been really enlightening, really amazing. And I think it's the personal stories that you've shared with what you've come across in your specific areas, how you're dealing with people in your areas, that has been really enlightening for me and interesting. It's really been super interesting. So, this episode has been awesome. We've delved into the prevalence of dentine hypersensitivity across the Middle East, Africa, and Pakistan. We've highlighted the regional differences influenced by cultural practices, dietary habits, and oral hygiene behaviors. Studies have revealed significant rates of DH ranging from 16.3% in parts of Africa to almost 15% in areas like Oman. Factors such as aggressive brushing, gum recession, and specific habits like miswak use or stress-induced bruxism play a key role in the condition's prevalence. The conversation today emphasizes the importance of screening and early detection to prevent dentine hypersensitivity progression and improve oral health outcomes. Geographical, age-related, and socioeconomic differences have been discussed, with strategies tailored to address the unique needs of various groups. Prevention tips, including desensitizing toothpaste, proper brushing techniques, avoiding acidic diets, and regular dental visits, have also been highlighted. We also address challenges in patient education and access to care, noticing barriers such as low awareness, cultural resistance, and affordability concerns. Guests advocate for increasing public education, professional training, and the development of dentine hypersensitivity management guidelines to enhance awareness and improve patient adherence in diverse communities. So on this note, I hope you all join us for the next episode. So once again, I'd like to thank Dr. Ninette and Dr. Tim. Please do join us for the next episode where we discuss in depth how to manage dentine hypersensitivity from a very early stage. So stay tuned, guys. Thank you.
Thank you.
Thank you for having us.
This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne does more than reduce the pain of dentine hypersensitivity. Sensodyne with Novamin can help repair and protect your patient's exposed dentine. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.